Hi, this is Shelley Kraft. We're coming to you live on SNN Live. We are on location at the William E. Hanna Jr. Innovation Center at Shady Grove in Rockville, Maryland. Standing with me is Paul Shardies of GenArraytion, Inc., a private company. Paul, welcome to SNN Live.
Shelley, thank you very much. I really appreciate the opportunity, and thank you, SNN, for all the work that you do for the small companies that will be the future companies of the United States.
Thank you for that. Appreciate that. So tell me about GenArraytion, and you have a unique spelling of it, so we might as well get that out. So tell us how the name was derived.
The name was actually derived through a contest when we first formed, and the company is spelled GenArraytion. That's GenArraytion. We use genomics in an arrayed fashion to create the next generation of molecular diagnostics for the infectious disease community.
Nice.
Thank you.
And that's what you do.
That is a part of what we do, and that is what we have been doing for years. What we're able to do is use a bioinformatics process at the genomic level, so the DNA or RNA, because that is the blueprint that makes the organism do whatever it does. That's what distinguishes it from the rest of the world. And so what we are able to do is to identify molecular signatures that are unique to a particular organism in a highly specific way. In addition to just the uniqueness, we determine functionality, so things such as antibiotic resistance, virulence factors. So what we were able to do, Shelley, now within a matter of hours, years ago and even now, takes days. So we are able to develop treatment-based diagnostics. So,
give me an example.
Perfect example is Staph aureus or MRSA, the flesh-eating bacteria, the one that the lady just lost some limbs.
Yes, big news item.
It is. And so we have a method of distinguishing the MRSA versus the MSSA within a matter of just a few hours, as well as identifying markers that are associated with different antibiotic resistance.
So what do you need to do it? What do you need, a blood sample?
We can do it from a blood sample. We can do it from a throat swab. What we need is a sample that contains actually just a few copies of the organisms. We do what we call a multiplexed assay. Multiplex means that we look for multiple regions along the genome. What that does to us is that increases our fidelity, so that the chance of getting a false positive falls essentially to zero. And that allows us to not only identify but to characterize it. And so we have our process where we can detect less than 10 copies of an organism and see each one of those 4 or 5 signatures that provide the level of fidelity to guide the physician in their treatment of the infection.
So who is your targeted potential investor type, or who is your potential customer, and also where would you find this diagnostic located?
Okay, let's start one at a time. Our potential customer is anyone who has the potential to get an infectious disease. Okay. That is you, Shelley, and that is me, and that's everyone that we know. We are working currently with a number of medical centers, both here in the Washington region as well as elsewhere in the country, getting clinical isolates to test our assays, our diagnostics against to demonstrate the specificity and the sensitivity. We are also working with one of the medical organizations to validate and to commercialize the MRSA assay. We have other, MRSA falls into what's called a hospital-acquired infection. There are others such as Acinetobacter baumannii, which has been coming over from some of our troops. And we're working, we're performing studies demonstrating the sensitivity and specificity in order to commercialize those tests.
And then once the tests are developed, and the reason why I was asking about investors was because I think that certainly from the diagnostic comes a therapeutic, correct?
Absolutely. And that's why what we're working towards, or we call it therapeutic-based diagnostics. What we have developed is a process for determining how to look for an organism, how to detect it, how to identify it and characterize it, that now works. We have demonstrated it with multiple organisms, and so we are at the process now, or at the point now, where outside investment can speed up the development of the diagnostics because our probability of success is incredibly high.
So why Maryland?
Why Maryland? Maryland is a wonderful location for government, military, and academia. Both my children were born at Walter Reed. I was on active duty at the time. And so this is an area that I like. My roots are here, and there are an awful lot of bright people in other companies in the region, many of whom you'll be talking with today, that provide a real critical mass of intellectual capability and business acumen.
So what's your background?
PhD biochemist, molecular biology. I spent 12 years on active duty, about 10 years in industry, and then for the last 5 years we've been running GenArraytion.
Well, it's a pretty interesting company. What's your website?
Website is GenArraytion, that's spelled GenArraytion.com.
Ladies and gentlemen, Paul Shorties of GenArraytion Inc. It's a private company. He's here today, and we are on location with SNN Live at the William E. Hanna Jr. Innovation Center at Shady Grove in none other than lovely Rockville, Maryland. I want to thank you for coming on.
Thanks, Michelle. I appreciate it very much.
Good to have you.
Thanks.